First of all, we as World Health Organization, we are supporting that this climate agreement becomes a very strong agreement, but it's also a very healthy agreement. For example, we estimated that in 2030, globally, there would be around 250,000 deaths occurring because of climate change if no action are taken. And in Europe, where I'm from, we are also estimating that one of the biggest problems is related to heat and heat wave further effects. The 70,000 deaths which occurred in 2003 are just one of the examples of what is potentially happening in the future. And our estimates are around 30,000 deaths per year annually in the over 65 years in around 2030, again, if no action is taken. So therefore, we are coming with a project which mainly is looking at the health included into adaptation as well as the co-benefits for human health of mitigation. Let me show you a few examples, if I may. Within the European health process, we have a working group of member states and health ministries and environment ministries of 38 countries and a number of agencies which are sharing lessons learned on adaptation. And so 24 countries have developed national adaptation strategies which do include health. Now, what are the health issues that are included? It's strengthening disease surveillance, it's better warning, early warning for extreme weather events, working across the sectors to anticipate what is likely to happen to be able to respond properly in time and to avoid, of course, death and disease. And there are many other initiatives like on water and sanitation, on improving the environment in general in order to improve health. On the co-benefits of mitigation, they can be large. Look, there are alone in the European region around 1 trillion euros are the annual costs of air pollution. Can you imagine? Which does mean it's mainly affecting people through causing cardiovascular diseases, or heart attacks, for example, or respiratory diseases. And these deaths, through proper action, through a climate agreement, but also action at the local level through proper transport, walking and cycling, or renewable energies, or eating less meat and walking and cycling and moving more, are considered to bring significant co-benefits. Therefore, we hope that under the mitigation we will be also aiming at improving the health conditions of our people. And these are the main two action areas we are promoting. So health in adaptation, as well as the co-benefits of health for health being addressed in the mitigation action.
And would you say that the government are taking these issues enough seriously? Are they involved in this thing?
It depends. I think at the local level, at the city level, there are wonderful initiatives ongoing and which could be doubling, tripling in the future years to come. And there are local partnerships, and there are partnerships, for example, between hospitals to renew their hospitals, to making hospitals CO2 with lower CO2 emissions, for example. And I think these initiatives will be ongoing because that's what a low carbon economy should be looking like also in the future. How much of this will be integrated in the climate agreement and how good the climate agreement will become in order to improve population health through proper action and mitigation, this is of course what we are looking forward is going to happen in this negotiation.
Are you optimistic about this?
Always.
Always. So this is a message of hope that you want to send today, or would you say something to the negotiators?
Take into account your own health, because you need it in order to get through this negotiation, and think about the future for your children and your grandchildren.
Just a last thing about the agreement, would you say that it's enough ambitious?
We are not yet there. Negotiations are ongoing, but we hope that at the end of the day, on the 12th of December, it will be ambitious and universal enough.
Thank you very much for your time and for your answers.